You know, one thing that came through with all those, all of you, is that this is not easy. And Vin actually had there all the layers he had to navigate and negotiate with to get such a career path going in the department. Sue didn't elaborate on, I know, that a huge volume of work that she had to do to get it up and running in her department. It's kind of like, well, here we are now, and it's absolutely amazing. But I know there was a lot of work and a lot of negotiating with the powerful bodies at various levels to get it happening. So thank you. If all the panel members could reappear, that would be good. And we'll have our fingers crossed that you can, Anne-Marie, but we know that you're there, and Lauren as well. So Anne-Marie is blank, but she's there. So don't forget to put any questions in the chat. There were 400, more than 400 registrants for this session. So I'm expecting heaps and heaps of questions. I'm going to ask the top 3 questions first of all the panel. So one of the very common ones is, I've found as a PhD student / full-time clinician, so those 2 things, that one of the major barriers to doing research is that managers higher up don't know how to support us. So this is open to all of you. We've got managers, such pathways and support. And so maybe that's gone some of the way to answering that question. But perhaps we can start with you, Lauren, to tell us what you, coming into such a role, having done your PhD, as a clinician, what would have really helped you?
Yeah, I think, thank you, Kathy. There's a few different elements of that. And I think sometimes if you have a line manager who's had less exposure to research themselves, sometimes it is just not knowing what support you need to undertake that pathway, particularly if you're one of the first people within your department to be pursuing that. So I would say some of it's looking into options that might exist within your existing framework within your health service. So often things like study leave, if you're enrolled in a postgraduate degree, can be applied for on a prorated basis in negotiation with your supervisor. So looking at those documents, having an open conversation with them about it. That was another element that I found was really helpful. Again, being full-time, letting my line manager know I'm okay full-time at this period of time, but within, you know, these particular months, I might need to be taking some additional leave. So providing some additional notice around that so that you can help work out what supports are required from that point of view. I also think it's really important to speak with your manager very early on if there's other elements of support that your project will require, whether that's engagement with other members of your team to assist with data collection, or what will be the expectations around the level of support that will be needed from the department more broadly. I think having an opportunity to have an open discussion about that, and that might even also involve your academic supervisors, can also help with navigating some of those processes. And ultimately, you know, your managers have the opportunity, if they support you, you're going to be presenting that work at conferences, publishing that work, which again shows that their particular team is a centre of excellence within that particular field. So I think it's also sharing the positives for the broader service of you engaging within that.
Thanks, Lauren. Does anyone have anything to add to that? So that great advice there, but really it's a common experience for people. And if you're the manager, the managers higher up often or mostly don't actually have research backgrounds. So it's hard for them to understand. So possibly you need to try and understand better and talk to colleagues from the university where you're doing your research, where you're enrolled, and try and work out what might be the most useful things. And then I've got a question to follow up that with, but I'll get to some of these really popular questions first. And this one's really, I think this one's really important. How do we change the workplace culture of research, in inverted commas, competing with clinical work when clinicians are in such demand and managers don't want to lose anyone? This is really, really common in most of the clinical workplaces I've worked with, that you're employed to do the clinical work and the research is kind of just a bit of an add-on. So, Sue, you have changed the culture. Like all of you, feel free to comment on this. But Sue, you've actually taken the bull by the horns here.
Thanks, Kathy. It's a great question. I think one of the super important things is allied health clinicians are always busy, and when we look at the work that we do that adds value, there's an evidence void, and that's not to say that the practice isn't valuable, but it's very hard for us to be guided by the evidence when the evidence isn't there. And so we can get drawn into doing busy work rather than important work. And I think research is a really great pathway to use to be able to answer some of those questions about what's valuable and what's busy. And I think the sell to people outside of the department or to the manager of the department is that very point, because if we are to make a difference in, I think, sort of taking really Anne-Marie's point, but to a very local level, is you need to understand what the drivers of, sorry.
Liver transplant unit. Medical emergency team to 8 West liver transplant unit.
The drivers of, so for example, in Victoria at the moment, there is a massive workforce shortage, and we're finding it very hard to recruit allied health clinicians across the board. If you can make a workplace that is interesting, that's dynamic, they're the promises I think that research offers in terms of being an employer of choice and using those arguments to ensconce a research culture that not only refines the work that you do every day into doing the important work and the valuable work and not the busy work, and also enables clinicians to really act at the top of their scope, to be able to be collecting data. We have a team that have, what they actually can see every day is the number of outcome assessments that they've done. They can follow the trajectories of the patients, and that helps them make better decisions about where their resources are put. So, creating dashboards can be really useful ways of informing clinicians to make better decisions, and they will then engage in the process because it's helping them manage their workload.
Perfect. Actually, I won't I'll just throw, there's a lot of questions. So I'll just throw questions at different people because all of you are perfectly able to answer them. And some of what you were saying, Sue, relates to developing a value proposition, which Anne-Marie was also talking about, but we might end with that. So Nick, are there tested strategies that increase success of clinicians in pursuing PhDs?
Thanks, Kathy. So strategies to encourage clinicians to pursue PhDs. Yeah, it's an interesting question, because when I've asked this, what I've found is that in fact, the people who, in my personal experience, when you have to try and convince someone to do a PhD, it's never going to work. So you mustn't really, and so I've been to meetings with it. What are the strategies we can recruit PhDs? I think it's being there and having a research active organisation. And then those people, the 1 in 7 of allied health clinicians with a light in their eyes, they will find it. They will find it. So it's kind of like a bit of a contrarian view in a way, that I found when I've stopped trying so hard, that it was easier to get clinician researchers involved in research. But if I actively pursued it and tried to sell it to them, they backed off. So Perhaps not the answer you wanted, Kathy, but that's been my experience.
I don't know if that'll be satisfying to the audience, but interesting. Vin, what do you suggest for clinicians who are keen to pursue research opportunities within their roles but lack the support from management?
It's a very good question, Kathy. I think collaboration is one of the things that they can pursue, and that collaboration, as I talked about in my talk, could be with people who are more senior researchers or clinical researchers. So academics, anyone within the allied health service in a different discipline to your discipline, and making sure that what you're doing as part of your research adds value to the service, adds value to your patients, adds value to the health service provider. It's very clear now, like working across 9 different disciplines, the difference that management can make to opportunities for clinicians to engage in research. And absolutely, when you have managers who are either trained in research or can clearly understand the importance of the research to the department and to the service they make to creating opportunities for the clinicians. But I think the main thing for the clinician is, what are you adding? How can you demonstrate that you're adding to that service with the research that you want to do?
Lauren, did you want to quickly add something to that?
Yes, Kathy, that just aligns with what Vin was saying. I just popped in the chat about people thinking about their elevator pitch. So how can you align what the goals are for your particular research project or area of interest with what the goals or strategic directions are of your department or the organization? So really think about the hook, which, how can you really look at how you can engage with that? And it might be, aligning with some of the broader things within the organization, but showing how you can sell that idea. And again, if you can, as Vin has suggested, look at opportunities to have external collaborators, which really show that you've got some rigor and strength behind what you're suggesting to do, that gives you a little bit more credibility as well, which can often go a long way.
Perfect. There's lots and lots of questions. Who would like to answer? Are there different options for clinicians to obtain support for HDR with an income? Scholarships, models of funding for research relevant to health service? Anything else that you can add there to support clinicians to enroll in a research degree? So what other role models do you have?
That's one of the areas that we're actively pursuing at the moment with the university, and trying to use our Melbourne Academic Health Centre through the MRFF to see what we can do in terms of supporting clinician researchers. It's been done in medicine, and we're looking to do it in other areas of allied health, and also to cross-supporting through the professor and the department a stipend to support clinical practice. But that takes, you have to be able to use the money. You have to have access to that money. And we're lucky that we have a special purposes fund that we can use for that money that's not operational. And so we're looking for those. We're kind of trying to identify what those models might look like if you have an MRFF support versus someone who's unable to attract support to do a PhD. But I think really that's a big area that needs wider discussion between universities and health services about how we can support people who, particularly clinicians who've got questions that have come up. It's a long time since they've been at uni. They're not competitive for a grad, but are worthwhile supporting because that, you know, they're going to stay in health. They've been in health for 10 years and they're going to stay in health. And we all need those people.
Absolutely. So none of this is easy. Yeah, Vin.
Thanks. Yeah, I agree with Sue. There has been some movement here in WA, and it started with an idea from our Dean of Research here at Curtin University within the Faculty of Health Sciences, with a collaboration between the university and the health service providers. The idea was to offer one PhD scholarship for allied health, one for nursing, one for medical. So 3 scholarships per year for 6 years. So at the end, we would have 18 scholarships. Now, the conversations have escalated now because it seems that the health department liked the idea and are trying to engage the other universities as well in that idea. And the research should be something related to the clinical practice of the applicant, and it would be done whilst they're training. So, for example, obviously it started with medical research, and I remember I was the only allied health in that meeting, and I'm going, oh, are we talking about only medical research, or talking about health research here? So it was an interesting discussion, but it started with medical, providing RMOs with part-time PhD scholarships as they were going through their medical training. And then now it's sort of expanded to nursing and allied health, but it's a work in progress here in WA, and hopefully we're going to have some positive outcome very soon of those discussions. But it's basically part-time PhD scholarship, and at a higher rate than the usual PhD scholarship as well. So we can sort of try to match with the salary of the clinicians.
Mm. And Lauren's put a really helpful comment in the chat. Do you want to quickly note that, Lauren?
Yes, just that for some smaller projects that funding might not necessarily be needed if you can embed it within what you're already doing within your day-to-day clinical work. So really having to think about your research question, maybe outcome measures or data that you're already routinely collecting, and how you might be able to effectively use that to help you investigate current practice or answer your particular research question. I know I've definitely had colleagues who've completed really high impact studies which were completely unfunded but related directly to what was happening in their day-to-day clinical practice. So just that it can be feasible depending on the scope and the support available in your organisation.
Fabulous, thank you. So here's some ideas. We're a tiny bit past time, but I'd like to get you all just to think for a moment about one piece of advice you have for clinical practices attempting to implement a research program. So if you can think of that, and Anne-Marie, if you could just very briefly give us a little bit, while people are thinking about the most important piece of advice, tell you just tidy up the value proposition bit so that people know how to go with a value proposition when they're trying to convince not just a minister for for funding, but maybe to their manager to get research into the daily practice, to do something like Vin and Sue and Nick are doing, and now Lauren's doing. So if you could do that, Anne-Marie, while the others are about to tell us the one important piece of advice.
Yeah, sure. Well, I think mine's kind of one important piece of advice as well, because I've been listening to people talk about, great ideas or the research they want to do on clinical practice. But from my perspective, and I think it's the same for a state government or even a hospital manager or a clinic manager, is just remember a lot of what you could do could be rolled out. It could be expanded. And so if you can build something into your research that acknowledges that, the care that you're providing is provided in many other places across the country. And yes, things need to be tailored to the local context, but often it's not that different across large parts of Australia. So if there's something that you could build into your research that acknowledges how what you are doing is relevant to other parts of the country, And if you can partner with someone who's got some experience in health services research or health economic research, suddenly you've made what looks like a small scale project nationally relevant. And you would be surprised how some of those really small scale things have a huge impact. And the reason for that is because there is not a lot of funding for allied health research. So when we look for research, we are looking at those things. So don't think it's insignificant. It's often the best we've got. so you know, if you could just think about the national relevance or the statewide relevance or how it could be rolled out from the start, and it will still be really valuable to us. So thank you, Kathy.
Fabulous. Thanks, Anne-Marie. Nick.
Yeah, I think the one thing, and picking up a bit on what Lauren said and Sue's talk, and I think it's really important that we see research as part of practice, not separate to practice. As Sue said, research is part of what you do at Eastern Health. And that mindset, I think, is so important. I think it's a real, you know, and how do you get there? We'll ask Sue explain some of the ways you get there to change that viewpoint, that culture. But if you have a viewpoint that research is separate to practice and always must be backfilled, then it's not going to happen. It should be seen as part of your practice. Really important.
Vin.
It's hard to add to that. So that was great, Nick. I'll go back to what Nick said in his talk, to have a clear vision. And on top of a clear vision, a lot of enthusiasm and also a clear, well-formulated and answerable clinical question. Because, you know, sometimes the questions are great, but may not be answerable. So a clear, well-formulated and answerable question.
And Sue.
I think that whatever you do needs to be relevant to the clinicians and the work that they do every day. So it may be down to collecting, deciding on an outcome measure that everybody's going to collect, and they're going to collect it about the same group of patients, and that they can start to see then that that it's possible, and then you can put some research framework around the fact that you've actually collected the data. And the only other thing I would say, because I couldn't really divide the two, is that you must have a university partner. It's just too hard to do without a university partner.
Perfect. And I leave the last word to our newest PhD graduate, Lauren.
Find good mentors to help support you on the journey, because it really is a team effort, and it's important to have a really strong support network.
Absolutely. And, you know, you can do things your own self just by reviewing your own clinical records. It's sometimes a really good place to start, and it doesn't need much funding or anything else. So now there are many, many more questions, and I'm really sorry that we can't get to them all, including what's the definition of a clinician researcher. And I don't know that there's a single definition, so we won't go there. But thank you all very, very much. Our esteemed panel of speakers taking us on a really good journey and showing us different models of how this can actually be done. It feels when you're starting out a bit insurmountable, like no one's supporting it, but it can be done. Here are people who have done it and brought a whole lot of people along with them and had massive impact and influence far beyond their own little tiny orbit, like big impact, which is changing the shape and the visibility and the reputation and respect for allied health. So congratulations to you all on what you're doing, and thank you for sharing with this massive audience today. And to that, I'd just like to let everyone know that this has been recorded, and the recording will be up on the Academy's website at least by tomorrow, probably. I'm not quite sure, but something like that. And you now have like a bit of a community of practice. Here are people who can put you in touch with people that might help you locally. There is Anne-Marie has a whole she's mentioned several groups that she goes to that are powerful. And Vin and Nick are both members of the conjoint professors group. And I know that they would also be happy if someone reaches out and wants a bit of a pointer. And the universities are always there willing to help. So this is the start of the next phase. Like it's all started now. We have clinician researchers, we have pathways. They're not nearly universal enough. Like we need them everywhere, but they are starting and they're respected. And so there's many models that we can start to build on in our own workplaces. So thank you all the participants who I can't see for joining us. And I hope that this has been helpful. Reach out. I'm really happy as well to put you in touch with people if you want to just reach out to me. I love that kind of stuff. And I love to support people trying to make a change and take the next step. So thank you to every single one of our really magnificent presenters and all the wonderful things that you're doing. It's very altruistic, it's very generous, and thank you. So bye everyone, have a good night.
Thanks, Kathy.
Thanks, Kathy.
Bye.